One exercise you might want to rethink including in your program is the barbell back squat. And the reason for that isn't because, sure, some people can do it and be solid movers. Some athletes can do it and have healthy playing careers. But on average, I think you'll be able to find squat and lunge variations that accomplish the same thing in terms of muscle mass and strength gains without having as many side effects or potential side effects when it comes to your movement quality, right? So what I'm really saying is that you should probably start to think about what exercises you include the same way you would think about medicine in terms of a benefit to risk ratio. Exercises, the same way certain medicines can, also can have side effects. So sure, a back squat can help me gain muscle, it can help me gain strength, but is it detracting from my posture? Is it detracting from my movement abilities? Is it maybe potentially causing me pain if the exercise pattern isn't a good fit for my own structural alignments, right? So my belief and what I'm an advocate for is finding variations of squats, like a split squat variation or like a front squat variation, maybe with heels elevated or something like that, so on and so forth, that can get you those same benefits without as much potential for side effects. So when it comes to the back squat, one thing you want to look out for is that anything like it that's going to axially compress your spine might have the potential to cause you pain, and at the same time, it can interrupt the rotational elements of the spine, that push-pull mechanism in part known as contralateral reciprocation that we need for things like walking, running gait, and pretty much all athletic movements, right? There's other ways in which it might be more likely to have you perhaps use the wrong muscle group or joint, such as a knee or a low back, things like that, whereas some of these variations might have a higher potential for you to load the target tissues without all of these side effects. Another thing that can happen from the barbell back squat too is that a lot of times people are intent on doing it with their feet pointed outwards, which, if done enough over time, can actually reposition your joints in a negative capacity, particularly at the hips. So again, not trying to fearmonger, a lot of people can barbell back squat and be fine, but I think on average, your average person, your average athlete would be a lot better off doing a different exercise variation when it comes to lower body squat or lunge motor patterns.